Hello, good evening, everybody. My name is homeopath Dr. Furqan Ahmed from Islamabad, and I've been working in this domain of respiratory illnesses from last 10 years in Islamabad. And I've been erecting and establishing free camps every year for say, about 3 months, like January, February, and March. Mostly the cases that came to me were of respiratory illnesses because of pollen allergy and some cases of pneumonia. And I was doing very fine, Alhamdulillah. And we had already developed a lot of focus and insight into how to treat the respiratory distress or these problems that the world is facing today. What happened in January when everybody came to know about Wuhan, we were very sure about it that very soon we will be facing this trouble here in Pakistan. So I started to work on it, and we shortlisted about 12 medicines out of 655 of basic homeopathic medicines. And from those 12 medicines, we developed like about three formulations, and we were getting ready that we are going to get the wave and we are going to be sick, and we want to heal ourselves and our families and our patients and everybody. The way of my camping is not like one day camp. I always do a camp for about 7 days at one place, and so that if somebody is not improving, we would actually call him back. We'll ask him to come over next day and tell us what is the prognosis. So my focus, Alhamdulillah, Allah ka lakh lakh shukar hai, Alhamdulillah, it was out of normal limits. Mm, and then we got our first patient of COVID who was COVID positive on 15th or 16th of February 2020. And we didn't have any tests at that moment. The man was coming from Faisalabad, and he was I asked about some contact detail because he was coughing very, it was what we call it in homeopathy, we can harsh cough that was actually putting pressure on the heart. His face would go livid, like his face would go all blotched at some place, that red blotches and then yellow at different places, and would cough, and the change of face, it actually showed that his lung trouble is actually very worsened because of those blotches. Then we started to give him some medicines, and he was already taking Brufen, and I remember he was taking some antibiotic. I don't remember the name. Velocef, perhaps he was taking Velocef. Oh, yes, he was taking Augmentin. Somebody had recommended him to take that. We had to intervene and we had to stop him from those two medicines, being because we were already very sure about it. We had all the studies from all over the world that how all of the Brufen family is actually not recommended in viral illnesses, especially that concern the lungs. So we asked him to stop taking the antifebriles. We also asked him to stop taking the antibiotics. And then we gave him his prescription. We gave him about two formulations, and every formulation has to be repeated alternately every 3 hourly. We asked him that our camp is here for next 5 to 6 days. He should try to call us or visit us next day. We were actually sitting without any hazmat suits or without any masks, we were not having those things at that time. Then he came very next day. He came at 1 p.m. After Zawal, and he said that the night was very tough, and he was running high fever in the night, and he was also, but the cough was the character of the cough, it changed. It was not very difficult to cough for him then. He was not an old fellow. He was around 40s. And what he told us was actually we checked his temperature, and his body temperature was normal at that time. So what I told him was that he's not running any fever, and he hasn't taken any antifebrile, hasn't taken any Panadol or Brufen to lower his fever, but there is no fever now. So he was actually very amazed at it. He said, "Oh, really?" And then again we asked him to continue the treatment and report to us again tomorrow. He came back again, and by the time he was actually walking very easily, because the first time when he came to our clinic he had to sit down, because he lived in some flats just outside of our camp. And the first time he came to us, he had to sit down at least at two places because of breathlessness. And now that was very dangerous of him to come like this. That is what we realize now, that it was a very tough case. But Alhamdulillah, our medicine worked, and in 48 hours, he was taking long strides and walking very comfortably. Of course, he had the cough, and he said, "Cash, Alhamdulillah, Dr. Saab, thank you so much. I'm perfectly fine." By the time this camp ended, like 4 or 5 days, I developed the symptoms. My teammate, the other person, one of the other person who was present at that time, he developed the symptoms, and we had to take the whole course for ourselves. And then my brother, he developed the symptoms in by March, mid March. We had to treat him, and he also got well. Then also one of our close relatives, he also got infected, and the sirens, it rose everywhere that in Pakistan the COVID-19 has spread. So we had to wrap up our camp because we there was no PPEs, and although because I thought that I had already developed symptoms, my blood would be teeming with antibodies. So we cannot abort the process for sure. That is absolutely clear. It, it would be a miracle if anybody could actually show that to who's able to abort the process. The treatment we give is actually one objective, single objective treatment, that to keep the lungs clean. This was our objective. Then there are actually many of my past patients who were like from the low cost families, and also some very rich people, some um, secretary level of the government, some ambassadors, and all of them started asking me that, do you have something? One of the patient was actually 91 years old. He was already on bed at his home with some cardiac issues, and he was already taking some medicines for his heart. He called me and he said, Furkan, um, I am COVID positive now, and I don't think so that I would go to the hospital because I don't see any ray of hope of life for me. I'm already 91. I'm already on bed from last 5 to 8 months, and I'm already taking heart medicines. So, do you have something? At that, I said, "Okay, sir, let's say Bismillah, and we should start to give you some treatment." Then I asked some about the symptoms. The symptomatic complex was absolutely clear. The COVID virus was actually working to take over his lungs. We started in medicine. After 4 or 5 days, he called me and he said, "What have you given me?" The Initially, I thought that there is some aggravation or some issue. I said, "Sir, as far as homeopathy is concerned, we would never tell you what we have given you. Why? Because in our philosophy, we also take the benefit of placebo effect that everybody knows about. We also take the benefit of it. Once you know the name of the medicine, you would go and read it, and you would say that perhaps it doesn't suit you, and you will make your own opinions about it. and that is not good for you. You should actually behave like a patient, and I should actually behave like a physician. And let's not talk about what I'm giving you. Let's talk about what are you feeling? How are you doing now? You said I'm fine now. That's why I'm asking, what have you given me? Actually, what I am so energetic. I'm breathing very fine. My shortness have gone. My cough has reduced so much, and that was actually a sigh of relief from us. Alhamdulillah. So now it's over 100 patients of all the ages, like poor and rich. No, none of our patient has shifted on ventilators. None of our patient needed additional oxygen, except that five or six of the patients were already on additional oxygen when they contacted us. They were actually having some those oxygen cylinders at home, and they were taking it because their oxygen saturation was below 88, around 92 to 88. So they were taking some additional oxygen. So what I told them that if it touches 88, you should be on additional oxygen, and you should continue the medicine. And after 3 or 4 days, those additional oxygen, the additional oxygen was actually not needed, because without it, they were above 92% of saturation. We also gave we never asked them to asked any of our patients to take any of probiotics or minerals or calciums, because calcium carbonate is as far as our homeopathic study is concerned, calcium carbonate is contraindicated in all those viral issues where lungs are affected. Okay, we can debate on it. Okay, we am ready to debate on it. Okay, why is it contraindicated? So we always ask them to stop all intake of calcium carbonates. It's not about the calcium; it is the carbonate part that we are against it, because um, we think that the virus uses the carbonates for its propagation. And the way we delivered vitamin C was not through vitamin C tablets. We asked them to take 1 glass of the carrot juice that we wanted. The vitamin A should be given to them, and 1 glass of red apple juice that had some iron content through the natural sources. Then this is how we treated all of our patients. Everyone, everyone. And none of our patients had, there was no case of relapse, because there was no suppression of the virus. We think the relapse occurs if the virus gets suppressed and hidden in the body. And there was no case of reinfection. Why? Because we think the reinfections occurs only in cases where the immunity is borrowed immunity, not naturally developed. And as far as the stats are concerned, only 0.66%, 0.66% of people have true reinfections, other than those who have been getting the immunity through borrowing the immunity from others. Otherwise, those who are able to develop it naturally, their immunity is very, very good. If they keep avoid the carbonates. That is all from my side, and welcome. I am actually I am of I can only treat those people who can come to me directly, and it's their choice. Otherwise, I cannot go and go into the hospitals and say that this is my ward now. And until unless, yes, I was willing. Actually, there were some instances where I was called that you should give some medicine. I had to refuse it. Why I refused it? Because the treatment was the patients were under control of some other doctors, and I said, okay, if anything happens to the patient, and what you'll do is you'll point your fingers towards me. Nothing that would happen, and I would only treat the person for to the patient who is totally under my control, or under the control of my team homeopaths, those who have been trained by me. All the best, all the best. Absolutely, I'm talking to you with complete satisfaction of my heart. It's about 1 year I've been treating these patients. We have absolutely no fear of the virus anymore. Even my home, my family, my father is 80. We have absolutely no fear left. Thank you so much. Thank you so much. All the best to everyone.